Module 5, Chapter 5. Welcome again to the class, Origins and Growth of Family Therapy. One thing I would point out about this particular chapter, which has been a running theme through the others, there are definitions and terms that will be on both the big marriage and family examination for licensure and the end of course test. So I will be sure and point this out. The historical roots of family therapy. This is also covered in our marriage and family overview class, but they do go back and revisit in theory. The decade following World War II, as our society was changing, the baby boomers, the first advent of women in the workforce, fathers coming back from the battlefield with PTSD or battle fatigue or shell shock, whatever term was used in that particular time. Marriages coming under stress, women who had made their own money, going back, transitioning from working back to the home environment, new homes, new mortgages, the advent of the middle class. A lot of stress on families, which gave growth to marriage and family therapy work. The Macy Foundation conferences on page 96 that were described in Chapter 1 began in wartime to help families, the accordion families, with a family member who goes out and comes back, like the fathers who've been deployed, and they continued into peacetime. One of the questions that they were interested, some of the questions they were interested in investigating was the family role in the development of schizophrenia. This is a major theme. All of the founding fathers of MFT worked with clients who presented schizophrenic symptomology. The evolution of the field and marital and then premarital. If we're having so many families in marital stress, what are we going to do? Can we do something preventive to help them prior to getting married? The growth of child guidance, career, schools, military, all that entire movement with the child guidance influenced both the professional counseling field, the marriage and family field, and the social workers. And what were the new advances in group dynamics and group therapy? First definition, page 96, schizophrenia. What role does the pathogenic, dysfunctional, problematic, troubled, distressed family play in the development of schizophrenia? Litz and Litz, 1949, is on the big test. The first to investigate family environment. They looked at 50 case histories. They looked at unstable homes, absences of parents, death, divorce, separation, by choice or by force. From Reichman, sounds like somebody from the Nazi camps, and the schizophrenic mother. Do we make children schizophrenic if they are having reactive attachment disorder, if they have cold, rejecting mothers? Can the mother, and they did not see mothers projecting schizophrenia onto their female offspring, but only to their male. The schizophrenic mother term denotes a domineering, cold, rejecting, possessive, guilt-producing person who is married to a passive, inadequate, detached, and effectual father. The male offspring has no acceptance from his mother and no good role model from his father, feeling confused, inadequate. And the idea behind schizophrenia at this point of the history and traditions is that it came from mixed messages. You can't be like your dad because he's kind of weak. You can't be strong like me because we're not the same sex. So the role model confusion and conflict, that was the starting point from Reichman's work, parenting. And this is where kind of the stereotype around counseling that if you want to know what's wrong with the client, blame the mother. The mother has done something wrong. Later on, this of course has been expanded. We understand schizophrenia to be genetic, inherited, as well as probably some other environmental and contextual factors that play into that. But families who have multiple schizophrenic members are going to be very chaotic, very disturbed, very problematic, very dysfunctional. And even though there are biological and genetic markers that help us understand the origin of schizophrenia, the idea of the schizophrenic mother concept still remains.
You said it's just on to male offspring?
That was the thought. Schizophrenic mothers contributed to onset of schizophrenia in their male children.
So it's not saying that the mother is schizophrenic. This genic means genesis, as in generating. So it's not that she is schizophrenic, it's that she creates schizophrenia in the male.
She creates an environment where the only way he can't meet the mixed message is the double bind.
Okay.
Damned if you do, damned if you don't. And can't please the mother, can't be like the father. The mixed messages, the communication bind is so great that the behaviors become very scattered, shattered, and confused. Schizophrenia, just for the point of reference, is not multiple personality disorder, as it is sometimes confused to be. That term morphed into a more newer term, which is dissociative disorder. Schizophrenia means disturbed, scattered, shattered, confused thought patterns. Word salad.
Roots. I know that friend, I'm not sure about, we can get to that later. I just wondered how it broke down. The first person who coined the term, what roots were they going for there?
Schizo is like schizopersonality disorder means that I need to be alone. I can't interact with people well. Phrenia, almost like mania.
Okay.
Okay. So the idea of a pathological parent is not scientifically or professionally accepted. I think that it still sort of remains on a different level. We go back to Gregory Bateson, first order cybernetics, applying the field of mechanics and mechanization to the family system. Palo Alto, the Veterans Hospital, is where all of this work was done by all the founding fathers with schizophrenic patients. And because they were coming out of World War II, by definition, most of them were male. The theory development always comes from the client populations being studied, even if it's found to be faulty later on. He coined the term double bind. And on page 98, it talks about the double bind concept. Bateson, Jackson, Don Jackson, Jay Haley, Weakland issued a paper in 1956 in which they held forth on the double bind concept to account for the development of schizophrenia in a family member. And right after the bold definition, it tells you a double bind situation occurs when a child receives repeated, conflicting injunctions from a very important adult in their life, usually their mother, with whom the child has a very important relationship. So there's a primary negative injunction. If you don't do that, stop, or you're going to be punished. Followed by a conflicting secondary injunction at a more abstract level. So if you have a child that is very destructive and the parent says, don't do that, if you do that again, you're going to be spanked. And while the child does it again, the mother laughs or gives approval to it and then takes the child up and spanks them and said, didn't I tell you not to do that? But it looked like it was pleasing to you because you were smiling, because it looked like a big joke. So repeated often enough, the sequence can set off upset, panic, rage, because the child is trapped in that. I don't really know what to do. The messages are not clear. They conflict. If I do what she wants me to do, she's smiling, but right after that I get in trouble. I get spanked, I get punished, I get rejected, I get shunned away. And not being able to reset the family mechanism by feedback loops. Remember, positive feedback loops expand to accept behaviors, and negative feedback loops tighten up to say, don't do this. If you do this, you might come out of the family group. That's how the family achieves homeostasis and regulates itself for balance, for equilibrium. With a schizophrenic mother, the feedback loops are conflicting, and there's no way for the child to understand what is okay. And if I don't know what is okay, I I'm either very anxious, I'm very needy and clingy, or I completely reject, or I just go and get very oppositional, rebellious, and do what I want to do anyway, and just take the consequences and don't care. So those are the kind of family dynamics. They're talking about the underlying messages. If the mother says, "Go away, you're a bad boy, don't touch me, I don't want to hug you. Come closer over here. You can't survive without my love. Are you listening to what I'm saying to you? Answer me when I talk to you. Don't you talk back to me. I love you, you're my hero. You're my zero. I love you, I hate you, you're my hero, you're my zero. Get out of my house, please don't leave me." It's kind of like borderline personality disorders, raising children and creating anxiety and very extreme neediness, clinginess, and behavioral disorders. So the covert and the overt, the verbal and the nonverbal do not match. That's what a double bind is, and it's around communication. They say, and they actually use the term I used on page 99, damned if you do, damned if you don't. So the historical importance of that research is that schizophrenia was a prototype of consequences of extreme communication failure in family systems. It was very gender biased, it had a very linear cause and effect outlook, and did not hold up well over time, but nevertheless it is part of the historical traditions of marriage and family work. Looking at Litt's terms that he brought to the seminal work of marriage and family therapy are the marital schism and the marital skew. He was on the East Coast. He wasn't out in California at the Palo Alto Institute. He was at Johns Hopkins and later at Yale in New Haven, Connecticut. And he began to publish his findings about schizophrenic development on children. He was a psychiatrist trained in psychoanalysis. He was kind of a Freud disciple. He rejected from Reitman's belief system, and he focused on pathological fathering. Rigid, domineering, hostile, paranoid, non-entities at home, passive, submissive, parents of schizophrenia. And he also thought of schizophrenia as a deficiency disease, that neither parent was able to be supportive enough or complementary enough with each other to be raising children. He saw the traditional masculine male as instrumental, like the father's a disciplinarian, the feminine role as expressive, nurturing, and he argued that parental failure to achieve role reciprocity led to marital disharmony and caused their children to be disrupted and disruptive. So his terms that are important here is marital schism, disharmonious situations in which each parent, preoccupied with their own problems, failed to create a satisfactory role in the family that's compatible with child raising, compatible with marriages, compatible with loyalty, affection, sympathy, support, respect. And that each parent may fear the child will grow up to be like the other parent that they don't like, so they send very disconnected messages. Don't be like your father, don't be like your mother. If you're like your mother, I'm not going to love you. If you're like your father, I'm not going to love you. Kid doesn't know which way to go, resulting, and I agree, resulting in some extreme disordered behaviors, but not maybe necessarily schizophrenia. And people that they study with schizophrenia may have had families that were just like this. Doesn't mean that it was a cause and effect, but they were trying to explain what they considered to be unexplainable at the time that they were doing their work. Marital skew. The marriage is not threatened, but they're very mutually destructive patterns. So one parent has a psychotic disturbance, psychological disturbance. The other parent is an enabler, a rescue, very codependent, very weak, accepts the situation, tries to teach their children that's just the way mommy and daddy are, and where our home is very normal, a great deal of denial and distortions of reality. So those two terms are on both tests. Bowen, Wynn, and the National Institute of Mental Health in Washington, D.C. Murray Bowen with Bowenian therapy, with transgenerational therapy. Bowen began to move the mothers into cottages on the grounds of the hospital where their schizophrenic children were being hospitalized, and he wanted to see if he could identify unresolved symbiotic dependent mother-child interactions. He wanted to see if he could find patterns that resemble the marital schism that Litz had studied. He talked about an emotional distance between children as an emotional divorce, the parent divorcing the child. He talked about marital relationships that were very, very poor, domestic violence, that parents wanted to settle for peace at any cost, peace at any price. And the child lived a very stormy, stressful, unhappy life, and he noticed that there was juvenile onset of schizophrenia. And so he determined that the stress of adolescence coupled with the problematic, distressed home life added to this. May all be true. Doesn't explain everything. He also proposed the notion that schizophrenia is a process that spans at least 3 generations before it manifests in a behavior. So you kind of have family members that have it when it's more controlled. And then when conflict and stress comes, it manifests and shows up. He did move the research further to say that schizophrenia is a fragmented, irrational style of communication. And that has held up till now. Wynne offers the term pseudo-mutuality. We're on page 102. Giving the appearance of a mutual, open, understanding relationship, but the word pseudo, fake, without really having one. We're going to put up a good game out of public and in the counseling office and at church. We're going to look like a very tight, happy, connected family when actually we have a lot of meaningless and emptiness in our lives. This is when you have scapegoated family members, identified patients. Some person in the family who can't quite meet the cover-up drags the family into session. This is very typical. The family is always the symbolic client, but often there's an identified client that brings the family in. Usually referred by the police, legal law enforcement, DFACS, or the schools, typically, because they're not functioning well at other community systems. They say, hey, you guys might need some counseling. Wynne was in 1958, so take that into consideration as you look at his work. Pseudo-hostility shows superficial, continuous bickering, looking like the families are very, very angry with each other. It is to mask a need for tenderness and affection. Sometimes in the 50s you had fathers and sons that couldn't hug, and they would greet each other with a little fake punch or very negative, derogatory comments to cover up what we would now think is a very normal emotion of love and tenderness between father and son. Maybe in the 50s and 60s that wasn't very comfortable. So that's what pseudo-hostility is. He also came up with the term in pseudo-mutuality families as a rubber fence. Very changeable situation in which the boundaries of the family shift. So some days it's okay for these things to come in our families, and some days the fence is going to tighten up. And the rules are a continuous flux, so I have no stability to know what's expected of me. And the family attempts to minimize threatening contact with the outside world. Wynne was a very productive researcher. He left the National Institute of Mental Health in 1972. He continued talking about pathological styles of communication. He called it communication deviance that contributed and transmitted to the development of schizophrenic and schizophrenic symptoms. And one thing that was pointed out by Goldstein, you can't perform an autopsy on a living client's brain to find out if there are neurological or inherited tendencies toward schizophrenia.
I think it's illegal, but
It definitely is illegal. And trying to deconstruct those family dynamics after a family member is hospitalized and already in trouble, it's very difficult to untangle the ball of yarn to go back to a specific starting point. Nog and Framo, James Framo, And Yvonne Nog talked about intensive family therapy and did work also with schizophrenia. You're not going to go wrong on the test if they're asking you for origins. The population were schizophrenic males, almost across the board. Marriage and pre-marriage counseling. Courts, gynecologists, physicians, lawyers, social workers began to specialize in family life, began to consider themselves to be experts in the field of marriage and family dynamics, and began to send people toward premarital counseling. If we're going to have so many problems with the marriage, let's see if we can get them into premarital counseling, give them some education, some information, some coping skills, maybe a little bit of help with their sexual relationship, help them to understand some things that they might come up, crisis, stress, transitionals, areas, divorce, infidelity, affairs, arguments over child rearing, money problems, sexual incompatibility, ineffective communication patterns going back to Murray Bowen, totally different family of origin patterns and styles, conflicts over power and control that cause imbalance in the family equilibrium.
Question.
Yes.
On 105, in premarital counseling, couples entering premarital therapy may do so as a kind of checkup on the viability of a relationship before marrying, or etc. How is that gauged then? Isn't it unethical to pronounce something like a relationship viable or not?
By the counselor. But if the participants say in counseling, I'm glad we did this and these things came out before I married you, maybe this is a bad idea.
All right.
Okay? Now they have to always make the decision. The counselor just kind of opens the room for that to occur. Martin and Bird stereoscopic therapy, where the counselor gets a double view of each client. I see you as yourself. I also see you as a partner, and seeing how those dynamics work out. One term on page. Do you have another question?
Now, where are they? Martin and Bird.
Martin and Bird are on page 105. 1, 2, 3,
Got it.
4.
Thank you.
Okay, fifth paragraph, I think. In concurrent counseling, the counselor works with both spouses, both partners, sees them separately. Sometimes that works well. If you don't see them conjointly as well, the danger of triangulating with one over the other, or never working with them individually on their individual problems, but never working on the couple problem. So the focus of counseling will be lost there, at least the marriage and family piece. Don Jackson in 1959 coined the term conjoint therapy, the situation where a couple or maybe the whole family's in the room with the same therapist at the same time. Now we think about conjoint to be more siblings, mother-child, adoptive or foster parent with an adoptive or foster child, partnerships. So it depends on, you could have cousins, any important family relationship that's problematic, but it's not necessarily a spousal or partnership or a parent-child relationship. So, looking at the child guidance movement, how important this is to us today might be argued, but it is featured on the large marriage and family test. The child guidance movement started early in the 20th century based on the assumption that if emotional problems began in childhood, as Freud was saying, that we developed these early on. Adler was also, and Jung were saying yes and agreeing. Rudolf Dreikers, who also came to work with Alfred Adler but did Adlerian work, began to expand child guidance centers into family counseling centers. If we're having problems in childhood, let's deal with them in childhood. William Healy, a psychiatrist, is on the test. He founded the Juvenile Psychopathic Institute in Chicago. It later became known as the Institute for Juvenile Research. He wanted to treat and possibly prevent juvenile delinquency. So he was working with families, but also trying to liaison between families and community systems. 1924, way back, the American Orthopsychiatric Association wanted to work with the prevention of the emotional disorders in children after World War I, then on through after World War II. And it's not hard to see that either family separation of a parent or parents coming back with PTS or depression or other kind of substance issues after being deployed in wartime could cause families to experience distress. Page 107, looking at group dynamics. John Bell, 1961, is a founding father of group therapy. And he took Yalom's work around group counseling and he overlaid it into family group therapy. And Jacob Moreno, in the earliest 1910, decided to do psychodrama with families, and that's just role playing. It's acting out. Virginia Satir took it a step further into family sculpting, if you've seen that, where they actually take family members and move them around the room. Family psychodrama could be an art. It could
That's Mnuchin making the people sit in different places, taking them outside, having them look in at another subsystem and function, but the use of where he put them, right? Are they getting that from him? Is he getting that from them? Or
Mnuchin did that to disrupt family balance and power.
Yeah.
Okay? But psychodrama actually is, if you look at Virginia Satir in a video doing sculpting, if we were in this room and we were doing family sculpting, if I were the client who was working it, I would be able, kind of like in the very old 50s TV shows, or Whose Line Is It Anyway? I would be able to pick April up, move her into a position that demonstrated how I saw her.
Okay.
Maybe if she was my mom, maybe I had her frozen in a position like this. I would be able to move you if I saw you as the dad. Maybe I would move you while she was fussing at me and you had your newspaper up and you were totally disconnected. That's what family sculpting is. Psychodrama can be sitting at this table where we're doing things like the sentence stems and we're all responding. When something's too hard for me, and you might say, what?
Give up.
Give up. You might say,
Fight harder.
fight harder. I might say, throw a screaming, raging temper tantrum. Okay? And then you take those three answers and then you begin to role play. You take the answers you've gotten from that very simple intervention and you begin to role play. And so you say, if you said give up, maybe one thing I would do in the psychodrama is have you adopt Anthony's position to fight harder and show me how you would fight harder. Have him adopt your position and talk about or demonstrate what it feels like to give up, to be totally defeated before you start. Maybe you guys would show what it feels like to be on the receiving end of a temper tantrum for me if I were the mother, where I could see myself through your eyes. So that's the difference between those. Very effective. That's when in this practice, when we do the family aquarium or the aviary, we've used the different marine animals, the birds to show, or we do the family dynamics map where they get miniatures around and they say, I see mine. Let me think of some examples. We had one child who saw their mother as a moray eel. Stayed in a room most of the time, under rocks. The mother had a substance abuse problem. When she came out with teeth bared and attacking blood. Horrible. Try to avoid her at all costs. Saw the father as, I think the father had been sexual abuse in the home. Saw the father as an octopus with all the tentacles reaching out. Couldn't be avoided. One of the child saw themselves as a guppy. One of the child saw themselves as clammed up in a hard shell. So when they began to do those kinds of psychodrama and using representation, externalized representation, and you get them to start explaining it and processing it, very quick, it's very much an Adlerian intervention. Very quick, fast assessment into family atmosphere, family roles, family rules, family perceptions.
Adler's collective unconscious.
Yes, individual psychology. Jung is collective unconscious.
Yeah.
Adler's individual psychology.
Okay.
Okay? So, and the very successful ways to do things, but ethical considerations and safety. You don't open the can if you send a vulnerable person, a spouse or a child back to be punished. So you choose your interventions wisely. But even if you did them individually instead of in a family thing and then came back later and they didn't see what each other had done, but you began to talk about ways to approach it safely. In California, in group counseling, they used to have, and I remember this from the 60s when I was somewhat younger than I am today, with Yala in 95, they had the Encounter group. And they had a lot of success with these groups. They also had a tremendous number of ethical concerns. So the Encounter groups is when you go in, they weren't necessarily always run by trained professionals. And the enthusiasm has waned because of some of the lawsuits that came from there. Some of those kind of encounter groups were where they did the trust exercise. You guys know what that is? Where you stand and you close your eyes and you fall backwards. That's great if the whole group is there to catch you. But what if you were an unpopular member or you had an antisocial person behind you and they chose not to catch you and you splatted and they said, oh, what did you learn? Well, I learned I couldn't trust my group. But you've had someone who's possibly been injured or embarrassed or whatever. So, trying to look at it's terrible. They also had it degenerated into some very bizarre sexual encounters as well.
These are called encounter what?
Encounter groups.
Groups.
The term starts on 107 and follows over to page 108. If you look at advantages of group therapy over individual therapy, they give you a principle and an elaboration. Group therapy might model what the family looks like. It certainly reduces social anxiety, isolation and anxiety. You might get support and caring and some residual learning from other people. You might be able to imitate and adapt some coping styles, have a greater exchange of feelings, increasing self-esteem, greater insight into our behaviors. When it works well, that's what happens. But it has to work well, and that a lot of that is based on the leader, the group leader, facilitator. The evolution of family therapy, if you look on page 109, you see a picture of Mr. John Bell, who was the leader, kind of the father of the group, family group work. Family therapy owes its legitimacy to the facts that it was carried out for scientifically defensible research purposes. It was done on clinical problems like schizophrenia that did not respond well to psychotherapy of that time. And many, many different people studied it. The founding fathers all studied it. Nathan Ackerman, a child psychoanalyst in the child guidance movement, is credited with writing the first paper to deal specifically with treating with an entire family. That's one of the reasons he's the marriage family founding father. He wrote one of the first papers. He began seeing entire families together a full decade before other therapists joined. This is Ackerman. Bale was at the Tavistock Clinic in London, and John Bowlby, who was a prominent psychoanalyst, and Bowlby is attachment theory. He was working with families that are very cold and rejecting or smothering, and how does that affect a child's attachment? 3 basic attachment styles: insecure, needy, clinging, crying. Secure, I can move out a little bit, but my mom will be right there, and avoid it. I've learned that I can't get my needs met from these people, and you know what? I'm gonna numb up and not try. So Bowlby was working with this when John Bell kind of met with him at a family conference, and they began to work together, kind of on a prodigal child. He had some misinformation, and he thought that he would begin to meet with the entire family. He got back in the United States. He found this family that came back. A case came to his attention. He began to try to work this method, the group method, as a therapeutic device. It was not widely disseminated or written until about a decade later, but it became a groundbreaking monograph, the article, and that coupled with Ackerman's text on treating families represent the foundation of family therapy as it's practiced today. And those two actually worked with non-schizophrenic families. Don Jackson joined in. Murray Bowen came in. Carl Whitaker here in Atlanta with Augustus Napier, Virginia Satir, Jay Haley. Andy Salvador Minuchin, Nodge, James Framo, all of these therapists became founding fathers in furthering the field's development around marriage and family treatment. Christian Middleford, 1952. I don't think you will see him, but I will at least go ahead and state it. He presented a paper that was the first to report on the treatment of psychiatric patients by including their families in therapeutic sessions. Pretty important. Carl Whitaker, 1955, went to Sea Island, Georgia. He would fly in entire families to each scene. He was joined by Bateson and Jackson, and he would hold these big family conferences in a kind of a conference setting, and the families were interviewed while being observed behind a one-way mirror. They collaborated and published a text on the psychotherapy of chronic schizophrenic patients, with Whitaker being the founding author of that. Gurin in 76 worked primarily with Jewish families. 59, Jackson and Bateman had founded the Mental Research Institute, the MRI, in Palo Alto, California. It's definitely on the test over and over and over. Joined by Virginia Satir, Jay Haley, John Weekland, and some others. They renamed it, they organized the Family Institute in New York to the Ackerman Institute for Family Therapy until Ackerman died in 71. So East Coast, West Coast, embryonic roles in the evolution of family therapy.
So this was Jackson and Bates did the MRI.
Right. So there became a rush to practice. It was a new field. It was wide open to research, wide open to being published, wide open to making a name. 1965, Minuchin. This will also be on the test. Minuchin formed the Philadelphia Child Guidance Clinic, and he worked, this is so culturally clear, but he worked in very low-income African-American project areas with very low-income families. And he invited Jay Haley, who he later broke from because Haley started off as a structural therapist with Minuchin, decided to branch off and develop strategic therapy for himself with his wife at that time, Chloe Madonis. The MRI on the West Coast, the Mental Research Institute, began to include families that showed or manifested dysfunctional symptomology, with schizophrenia, with delinquency, with school underachievement, with psychosomatic disorders, marital conflicts. Virginia Satir came and she published Conjoint Family Therapy, which is on the test, and did a great deal of work with the family approach, and she began to hold professional meetings and workshops to train other counselors around the world.
I thought Conjoint was Jackson.
He coined the term.
Thank you.
But Satir began to work on it, as did Haley, as did Minuchin, as did many others. Let me see what else I think is important here. Oh, John Howells in 1975, a British psychiatrist, devised a system which we are not necessarily using today, obviously, if you look in the DSM-5, but he wanted to have a family diagnosis preparatory to doing therapeutic interventions. And in Italy, Salvini Pelosi started the Milan work because he was in Milan, Italy. So he formed, with Chechen, he formed the Institute for Family Therapy, and he is known for, if you look at the test, the term is long, brief therapy. So we're only going to have sessions once a month, but we're going to do it for a year. To my knowledge, and I could stand corrected if need be, I don't know of that many people who are purist Milan therapists at this point. But he did have some success with very resistant cases. So, and that kind of speaks to the point that everything works at least some of the time, and nothing works some of the time. So, innovation techniques and self-examination. Multiple family therapy was treating, adding families into hospitalized schizophrenic members in group therapy sessions. Multiple impact therapy is where you have kind of a treatment team. A psychiatrist, a doctor, a counselor, and they're all working the same case. Network therapy, you're working in the home of the client or patient with the family, including their friends, neighbors, and employees. Can you see that as an ethical complaint so quickly? Colorado, they treated families on outpatient basis, and that was kind of the beginning of family crisis therapy. Instead of hospitalizing them as a disturbed and scapegoated family meeting, they tried to meet them in the family and work on that. The GAP report, Group for the Advancement of Psychiatry in 1970, just began to talk about psychiatrist awareness of families' roles in symptomology and conflict formation. Dysfunctional families produce dysfunctional members. Happy functional families produce happier functional members most of the time. That does not mean that dysfunctional families cannot produce a happy, well-adjusted member, or that happy, well-adjusted families cannot produce a dysfunctional, problematic family member. See, there you go. 114, conductors and reactors. Beals and Ferber, I don't remember them on the test, but I do know that these terms are there. Conductor therapists are active, directive, and involve themselves in the center of the family group. Doesn't necessarily mean these are even terms that we use now. This is talking about origins of family therapy. Reactor therapists are less theatrical. So, and conductors, think about Whitaker and how outrageous he was. Reactors are less theatrical, they're more subtle, they're more indirect, they observe, they clarify. Maybe Bowen might be someone you could think about in that. They talk about what the family presents to them, they negotiate differences, but they stay outside of the family group itself.
And they found, of course, that the conductors were ending up being more productive because of second level cybernetic.
First order.
First order says that the observer can be removed from the system. Second
Or the system stay. And the second order says that they
when you observe it, you're already part of it.
Right, okay. Well, I'm thinking about first order and second order change. So if you have someone making themselves part, you may have superficial change. When they remove themselves, the change of the family implodes because the homeostasis is disrupted because this very flamboyant, active, aggressive, directive leader has taken themselves out. The family has to be able to function with or without outside of the counselor and outside influence. At this time, with this work, the feminists began to critique traditional family members and speak for themselves and begin to empower females in this group. And when you think about it coming out of 1950s, 60s, World War II, you can see that gender biases were built in. There were very fixed male and female role models in families and in society. And as those things changed and this cultural awareness grew around that, families became disrupted. Professionalism, multiculturalism, new epistemology, the Association for Marriage and Family Therapy. This might be an important thing to know as a marriage and family therapist. Had less than 1,000 members in 1970 to 7,500 in 1979 to 23,000 in 2001. They're still a fairly small group. Marriage and family approved supervisors, such as myself, are still a very small group. The American Family Therapy Academy was formed in 1977. They kind of got sandwiched out because they were looking at family therapy from clinical and research issues totally distinct from counseling or marital therapy. Then there was the International Association, the Division of Family Psychology, the International Family Therapy Association. All of these began to publish journals and publish research. Looking at the bottom of page 116, medical family therapy emerged as a subspecialty, trying to marry medical doctors' work with psychiatry with clinical therapeutic work.
How'd that turn out? Isn't
cement a community systems approach, a systemic approach. Because all of these helping professionals play an important role. Looking at integration, eclecticism, impact of constructivism, how do I see myself, what is my development, what is my story, what is my narrative, who's the expert of my life, those things begin to also come in. Managed care is just the impact of third-party payers like insurance companies, restrictions on the numbers of session, diagnoses that will be paid for. By the mid-1990s, family therapists had been forced to re-examine not only their traditions and their theoretical assumptions, but how they could effectively intervene with troubled families and still be able to practice in real-world environments with third-party payers, with the community systems, with the changing families. So there's a clinical effort to make family therapy more focused and more meaningful through language, rather than just from a behavioral process. Consequences, sequences, family interactive patterns. Harlene Anderson and Harry Gulishin came to the forefront with working with families in this part of the tradition. So that wraps up this particular module. When we begin next week on Module 6, Chapter 6, Psychodynamic Models. And who will be presenting on psychodynamic? So it will be me. Pretty simple. Alright, so I will have some things to show you that will kind of work with this particular model, and we will discuss this at length. Thank you so much. We will regroup.